Introduction. Endoscopic ultrasound-guided pelvic abscess drainage is an effective and minimally invasive treatment option for pelvic abscesses. It involves stent release in a confined space, which is technically challenging. Case presentation: a 68-year-old Japanese man was admitted to our hospital with severe anal pain and fever. Computed tomography revealed pelvic abscess around a rectal carcinoma. The distance between the anal verge and tumor was 45 mm. We first confirmed the tumor margin with esophagogastroduodenoscopy and then placed endoscopic clips in the normal mucosa at the anorectal tumor margin. EUS pelvic abscess drainage was planned to avoid the tumor before the carcinoma operation. The abscess was punctured with a 19-gauge needle via the rectum, 40 mm from the anal verge. Since the endoscope is inserted into a narrow and short space, we anticipated that it could easily shift its position and exit the body through the rectum. To keep the endoscope in a stable position during DPPS placement, we performed the intra-scope channel stent release method. To keep the endoscope in a stable position during DPPS placement, we performed the intra-scope channel stent release method as follows. First, the inner sheath was pulled out of the DPPS, leaving only the guidewire. Second, the guidewire was pulled out, leaving only a soft tip within the DPPS, and the DPPS was pushed straight into the abscess. Finally, the axis of the DPPS was changed, and the DPPS was pushed and released to bend. Thereafter, two double pigtail plastic stents were placed inside the abscess. The procedure was performed safely without complications. Conclusions: in the present case, a lower rectal carcinoma with abscess formation was resected en bloc, including the abscess and drainage route, at the time of radical resection. We are of the opinion that EUS pelvic abscess drainage procedure is an effective procedure for control of pelvic abscesses associated with rectal carcinomas, and our stent release method is an especially useful technique for carrying out the procedure in a limited space.